Good morning. Thanks everyone for tuning in to this morning's Wisconsin Health News live virtual event on the public health impact of racism. My name is Tim Stum. I'm the editor of Wisconsin Health News. This is our largest virtual event yet. More than 500 people have registered and signed on through our Zoom platform. In addition to that, this event is being live streamed on Wisconsin Eye and on our Wisconsin Health News Facebook page. So welcome to all from wherever you are tuned in today, this morning. This large virtual turnout is, of course, a testament to today's guest, Milwaukee Health Services CEO, Dr. Tito Izard, one of the leading voices on this important topic. Thanks so much, Dr. Izard, for sharing some of your valuable time with us today.
Thank you.
Before we get started, I want to make sure we thank Badger Bay Management for hosting today's virtual event in partnership with Wisconsin Health News. Thank you also to our generous sponsors of the Wisconsin Health News Newsmaker series. We view these events as an extension of the journalism that we produce in our daily email newsletter. And these events would not be possible without the generous support of our sponsors. So a huge thank you to Anthem, Blue Cross and Blue Shield in Wisconsin, Deloitte, Froedtert and the Medical College of Wisconsin, Husch Blackwell, Mayo Clinic Health System, Briesen Roper, and the Wisconsin Hospital Association. And extra thanks today to Anthem, Blue Cross and Blue Shield, who is today's featured sponsor. Here to say a few words is Anthony Woods, president of Anthem's Wisconsin Medicaid plan. Anthony, thanks so much for joining us today.
Hey, thank you, Tim, Dr. Izard. Glad to be a part of this, and I thank you for accepting Anthem as a sponsor here. You know, amid all of the call of action and mass protests after killing of George Floyd and others by the police, COVID-19 has taken a disproportionate toll on African-American communities. Connecting both is systemic racism, which many experts consider one of society's biggest public health threats. Anthem continues to announce updates and resources that can help provide increased access and care, helping alleviate and address, the stress that many individuals, families, and healthcare systems, not only across the nation, but here in Wisconsin, as well as during this unprecedented time. Anthem, Blue Cross Blue Shield Wisconsin Medicaid helps improve healthcare access and quality for approximately 100,000 residents who participate in the state's various Medicaid programs. Against the backdrop of the national healthcare crisis, Anthem has been deeply committed to supporting its health plan members, customers, care providers, associates, and local communities through affordable care and lasting recovery. Our parent organization, Anthem, has committed $50 million from Anthem's Foundation for COVID-19 responses and recovery efforts to help areas of greatest need, including care providers of safety, food insecurity, and mental and behavioral health resources. As an organization that's committed, connected, and invested in our communities, Anthem is speaking out and taking action against long-standing social injustice, racial inequality, and health disparities in America. Anthem and the Anthem Foundation announced additional commitments to drive national change with a $50 million pledge over the next 5 years on directly impacting racial injustice, strengthening our communities, and addressing health inequities. With over 75 years of history in local communities, Anthem is compelled by our values to improve the lives and the health of communities and help build a better, more equitable and healthy America. This investment will reinforce and strengthen our longstanding partnership with national and community organizations that are working tirelessly to combat health systemic, racial inequality, and health equities. The effects of COVID-19 together with the recent social unrest have further illuminated racial inequities and health disparities that have historically plagued our communities for far too long. These local communities where we live and work are also where we serve others through the lens of inclusion, acceptance, and belonging. The focus will not change. We pledge to be leaders and work in solidarity with our communities to change the status quo and address the factors driving disparities in our healthcare system and in the society as a whole. As we build upon that legacy, Anthem and its foundation will work side by side with new and existing partners to find a way to unify and ways to foster conversations around these issues and open an important dialogue for all Americans. Anthem is committed to creating, enduring, and change in communities around the country. We are dedicating funding to support community partners that will work to help revive and rebuild neighborhoods in Wisconsin and the communities across the country that we serve. We will be working with nonprofits across the country focused on opportunities, economic development, and job creation. We're expanding our associate giving opportunities by providing one-on-one match for the contributions to the following organizations: National Urban League, United Negro College Fund, the National Association for Advanced and Colored People, Boys and Girls Club of America, Race Forward, and the United Way. Anthem associates are passionate and dedicated to supporting their communities, and with the help of our associate resource groups, we will engage in a deeper, more meaningful activities to address health disparities and racial injustices in our communities. And through those Dollars for Doer programs, we will enable all of our associates to provide those funds for nonprofits. Anthem is committed to lifting up our local communities during this difficult time, but important time change and working each day to ensure that all people across all communities are part of a more healthy nation. And I want to again thank you, Dr. Izard, for leading this conversation, and Tim for accepting us as a sponsor. I look forward to furthering the conversation.
Great, thank you so much, Anthony. Thanks for the great support from Anthem, and thanks for all the great work that you guys are doing. As Anthony highlighted, systemic racism is the link between these calls for action and the mass protests that have taken place in Wisconsin and across the country after the killing of George Floyd and many others by police. And it's the driving factor in the disproportionate toll that COVID-19 is taking on Black and minority communities. This is sadly, but not completely surprising news in a region like Milwaukee, where these disparities are even more stark. In Milwaukee, Black babies are 3 times less likely to reach their first birthday than white babies, and life expectancy can vary by more than a decade based on the color of your skin. As the CEO of Milwaukee Health Services, Dr. Izard is uniquely qualified to discuss this topic. Izard is a family practice doctor who has led the organization since 2010. Milwaukee Health Services is a federally qualified health center on Milwaukee's north side that recruits and employs more African American and minority providers than any other provider in the state. So I have a long list of questions lined up for Dr. Izard. And then we are going to leave some time at the end for audience questions. You're unfortunately not going to get to all the questions that were submitted, but thanks to everyone who did submit questions with the registration. Picked a handful that I think represent the sentiment of the questions that were asked, and we will ask those at the end of today's event. We're going to do this all in the less than 25 minutes that we have left here. Right. So Dr. Izard, thanks again for being here today. As has been well documented, the disproportionate impact that COVID-19 is having on African Americans and the growing movement over the killing of George Floyd and countless other African Americans are linked by these common roots of systemic racism. Can you start by talking about the role that racism has played in the health inequities that have been further exposed by the COVID-19 pandemic and the impact that racism has had on overall public health?
All right, so thank you, Tim, and thanks to Wisconsin Health News for allowing me this opportunity to have this conversation, and for Anthem for sponsoring it. Just in order to really understand this topic, you have to start off with kind of an introductory statement and really having people understand and hopefully started to embrace the whole understanding that for America, the enslaved body was an asset. Okay, it could be used as currency, collateral, and credit. On June 19th, 1865, what we call Juneteenth Day, the freed slave became an American liability. Okay? No other ethnic group, including the Native American, began its independence in this country as an American debt. And so when you understand that concept and how moving forward as a country, we never resolved that debt. After 400 years, America still has remained with this debt towards the descendants of slaves, descendants of slavery, which is the actual institution, okay? So because that hasn't been resolved, when we look at health disparities, all health disparities, every single one, every single social determinant of health, all of them are the direct consequence of being an American descendant of slavery. So when we look at the issue of COVID-19, really this pandemic caught a lot of people by surprise, but it should not have caught us by surprise, because if we were actually paying attention to the plight of the African American or the Black American, really when you talk about those that have lineage to slavery, this ethnocultural group this ethnocultural group actually has no defined name. It's because at one point, we had many different names that we called ourselves, but even nowadays, when we say African American, what does it mean to be African American? Someone who's from the continent or the diaspora can, in this country, be called African American. Even in our census, you mark the category, are you Black or African American? Black is a race. It is a social construct that really has no meaning or purpose scientifically. We all know that, we agree to that, but we still use it. So for people who have lineage, what does it mean to be Black, okay? And it's to say Black or African American. Well, what is African American? If you're from the continent, like President Obama, and you have who's a mother who's a white American, are you not African American? But are you the same as someone who has lineage? So I provide that background to let us know we don't even really have an understanding of the population that we're talking about. And then because the lack of disaggregation of data, when we say Black and African American, we're mixing all of people who are identifying as Black as far as the diaspora together and not really truly being able to see what's going on. And so what has happened with something like the pandemic, it really has exposed this need for restorative health equity and the need to finally, as in America, reconcile this historical debt that we have in play.
Thank you, Dr. Izard. Such an important way to frame all of this. And I wanted to talk more specifically about slave reparations. This is something that I know that you talk about often. It's something that is maybe gaining a little more momentum. I saw a New York Times article just came out a couple of days ago, an opinion writer kind of renewing this call. This is something, though, that has been in Congress, a bill just to study the issue. It was first introduced to Congress 3 decades ago and has not moved. It has not advanced in 3 decades. Why do you think that is? Well, what has been the main roadblock to move forward with this issue?
Well, in this conversation, you will never hear me blame any one person or even one group of people. This is the issue of America, because the American dream, African Americans, and I'll use interchangeably African Americans and ADOS, American Descendants of Slavery. I'll use them interchangeably in this conversation. But the whole point is that when we think about what, as a people, what we allowed the country to do, and then what the country has done to us. So we have this mixture of racism for the races is extremely harmful. But racism to those who are being oppressed obviously is harmful, and we can see that play out. So what happened in our country is that as we moved past 1964 and 1965 with our Civil Rights and Voting Rights Act, there was a move to, America has this idea that, well, your individualism is important, so meritocracy. So we moved away from the core of racism, but is always structurally there, to try to focus on classism, all right? So basically, and that was supposed to be based upon meritocracy. But the reality is we never reconciled the issue with race in the first place. So when we had the development of our US Constitution, the 3 core cracks in our Constitution was the issue of women's suffrage. In particular, at that time was focused on white women's suffrage, not Black women's suffrage for voting rights, Native Americans, and the failure to follow through on properly with the treaties, and this issue of slavery, okay? And as we move forward beyond slavery through Jim Crow and all the other components, programs that were developed, the Homestead Act, and really Ira Katz-Nelson describes it as when affirmative action was white, all the various programs that were permitted for white society to develop. And as that developed over the years, this structural racism in our country really became calcified. And now businesses or institutions built upon that structural racism, so that now the institutional racism played out in the organizations if it did not specifically have programs to try to overcome the structural racism of this country. So all of us as Americans have played some role in this racist issue, including even Black Americans, moving from the 60s, and hopefully moving to this idea. Well, maybe if we demonstrate that we're good Americans, then we will be able to achieve the American dream. And the reality is, no one really had the data to understand the wealth issue. And now we recognize that it is your wealth position that stabilizes you and not your income. So there was a lot of focus on good jobs and all of that coming out of the 60s and 70s, but not really ever recognizing that wealth had already started to calcify from the 1940s forward. And
so if we did move forward with slave reparations, it would start to address this important wealth gap that is generations long. Do you see momentum? Do you see momentum to maybe have something finally move in Congress sometime in the near future?
Well, I definitely think that it has to move forward. Unfortunately, because of everything that's going on, maybe there's an opportunity to actually redress this issue again. But the reality is, without a comprehensive reparations plan, okay, HR 40 that you're referring to that's in the House, it's only to study, okay? And it's really not serious enough, to be honest about it, okay? You can study something to death, but the reality is we need to go beyond just studying this issue of reparations and actually come up with a very serious plan. It has to be very comprehensive, okay? And part of that comprehensive plan will be what I'm referring to as restorative health equity. Because the reality, as I mentioned, when you look at the social determinants, so whether you're talking about, getting a great education, whether you're talking about housing or home ownership, whether you're talking about, food deserts and nutrition, whether you're, talking about health that we're talking about, whether you're talking about neighborhood safety, all of these issues, and it's important to understand that when we look at different minority groups, it really could be a different conversation. But specifically in this topic, referring to the Americans with lineage to slavery, is so critical and important to understand that every single one of these factors are actually directly linked back to our enslavement. And if you don't reconcile those issues, and now because of our economy being more global, the calcification of wealth position really has solidified us into a position. And that's why you can see that even so you mentioned, for example, health disparities as far as infant mortality. We know from a lot of great studies that even when you adjust for those confounding factors such as education, location, where someone lives, behavioral such as not smoking, all of those things, African Americans still have higher infant mortality rates, even though they have none of those negative personal behaviors that they've done, okay? And so it shows us that it goes beyond just what you can do as an individual. And if we keep trying to force the conversation on the individual level, the individual is important. As a physician, I work with individuals, and I can help anybody achieve their goals as an individual. But that's completely different when we say statistics applies to large groups of people, they don't apply to individuals. So statistically speaking, when you look at the African American population, without a doubt, it's hard for anyone to argue that racism and the historical injustice and this wealth gap is not a major factor that's driving health disparities.
When we talk about health disparities, they're bad across the country, but they're extra bad in Milwaukee, among the worst in the country. Why is it so stark, that this issue is so stark in Milwaukee?
Yeah, and that's a great question, and it's a very difficult question. And unfortunately, all of these questions, are actually pretty complicated. It's hard to explain this without having some understanding of history. So even though we know that the South lost the war, although through the lost cause and the way with the issues right now with the monuments from Civil War monuments, that you would think that they won the war. But if you go back to Reconstruction, which most Americans are poorly taught, we're poorly taught in American history completely, but most people have no clue about Reconstruction. Reconstruction, that 10 or so years right after the Civil War, where African Americans or the slaves, the enslaved, were supposed to be given 40 acres and a mule or land in order to be able to move forward. And what was interesting that in 1876, with the election of Rutherford B. Hayes, that there was you essentially had an election that came down to Congress, and Congress, they still couldn't make the decision. So the Southern Democrats decided, okay, we would give up the presidency to the Republicans for Hayes in order for the troops to be removed from the South. Okay, and essentially most people agree that was essentially the birth of Jim Crow. Okay, we all know what happened as a result of that. So because of the troops, the federal government failing to protect African Americans in this country during Reconstruction, we suffered almost another 100 years of a new form of slavery. All right, and so Blacks moved from the South to the North. Well, at that time, by the time when you look at the migration of Blacks out of the South to places like Milwaukee, there were opportunities for manufacturing and employment. But Milwaukee was one of those cities that was actually on a later end. You know, Chicago was earlier. By the time people got to Milwaukee, and then by the time we hit the 1970s, you know, there was a significant, with the whole economy and the recession that was going on in the world, then what ended up happening is and with globalization of jobs and jobs left Milwaukee. And so this middle class Black it essentially created a vacancy of employment. And because we had redlining and the lack of integration that never really happened in Milwaukee, then you had the central city. If you look at a map from the 1965 time frame and when Val Phillips was fighting for housing to where Black people live in Milwaukee right now, it is very similar. So when the jobs were lost, and of course, Black people suffered the most in the loss of jobs, then it created this void. And now, again, it comes back to wealth position. If you didn't have savings, if you didn't have wealth, you weren't stable. And so now the lack of wealth, okay, because there wasn't reparations, the lack of now income put people in a position that their health started to fail, your housing was failing, and then all the other factors, right? So you can see the cascading effect that would occur, all because of this historical structural racism with institutional racism on top of it.
And so if we look to address these long present health disparities, as you have highlighted, this is not going to change overnight. What are some steps, though, that policymakers could take now to start to chip away at some of this?
Yeah, and that's a great question. And I think we can think about it from different avenues. So I always talk about what can the individual do? And so individually, there's things that I like to, when I'm working with families, really break this down and say things that you can control in your life, things you can influence, and then things you're concerned about. At this juncture, you need to spend 90% of your time on the things that you can control, and not worrying about all these things that you're concerned about, right? So there's things that we can do individually and working with as a doctor, patient, and other things. We can work with you as an individual to overcome your circumstance. Okay, but in the end, that's still not going to be complete. So there's things we do at the individual, there's things we do at the family, and things we do at the community level. So at the community level, we start addressing some of these other larger issues. So now when we move to issues, so public health, for example. Public health is supposed to be a builder or collaborator between communities, the public health system, whether it's the health department, working with health systems and clinics, working with local municipalities, working with the state, as the federal resources are distributed to the state to ensure that all of its citizens, are being treated in a fair and equitable manner. But the reality is that hasn't happened. So public health is broken down related to that. When you look at, because of institutional racism, that companies now have to compete in a global market, but also just in your own state or local or in the United States, you're competing. So the competition that, one of the things that orthodox economics said, that bigotry would essentially be removed out of the marketplace, because if a company limited itself on getting the best employees, then they would be at a disadvantage. But the reality in America, that has never came true. So it shows how institutional racism has continued to play a role. And so many companies now, what they could do now is start making sure, if you as a company, if you're getting a significant portion of your revenues from a vulnerable population, whether it's Hmong, the Latinx, African American community, you have to look at your management level. So if you look at the median salary in your company, all those that make above the median salary in your company, and if the percentage of if that vulnerable population is not represented in that top half, the top half of your employees, then you know that your company, you are a wealth extractor instead of a wealth stabilizer. So what needs to get done now at the company level is to reassess, is your company a wealth extractor or wealth stabilizer? And if you're a wealth extractor, then you need to start thinking about your community engagement and how you can go about working together to change that over a course of years.
I'm going to shift to the audience questions because we are very quickly running out of time. We should have allotted way more time for this. They do kind of follow up with this too. What can provider organizations do what specific actions should provider organizations take to advance equity in the provision of healthcare services?
Right, so related to healthcare has to decide that it's going to move in the direction of restorative health equity. Because it's no longer good just to use the term health equity. You really have to, when you talk about the African American population, you have to think in terms of restorative health equity, right? And your organizations, you're not even being serious until you look into your own internal organization and make sure that there is the representation of that affected population in your organization. If you don't have representation, it'll be very difficult for you to actually truly move the needle significantly. So that's where we talk about community engagement and working collaboratively with communities.
So we, so the next audience question, what immediate actions and it kind of follows up on what immediate actions can healthcare, philanthropy, community health take to address health inequities? So kind of follow up with that. What are some steps that can be taken right now to address health inequities?
Yeah, so what I would encourage is health systems as they continue to get bigger and philanthropy. I would encourage that philanthropy, if you're really serious about trying to move in the direction of health equity, then you should not put your dollars in any of these institutions who do not have a serious a plan on if they cannot articulate to you what is their, how successful are they with their community engagement, then they're not a serious company when it comes to addressing health equity, all right? And so it requires now philanthropy and businesses who are serious to actually leverage their organizations against racism, okay? It's one thing, so you've heard me talk before about malignant indifference. Malignant indifference is we have the opportunity to make a difference, but we don't. So there's a big difference of slavery of the 18 and 1900s where it was harmful to people versus the removal of that harm is not the same thing as doing good. So we have to remove the harm, we have to do good, and we have to stop being malignantly indifferent.
So and I'm going to kind of take over for the last two questions quickly. As has been well stated, COVID-19 did not create these health disparities, but it has further exposed these long existing disparities. There does appear to be a growing awareness of their importance, but the pessimistic view is that this is something that has been talked about a lot in the past and a lot of progress has not been made. Do you think things are different now? Do you think that some type of change, some type of needed change is finally imminent? Why or why not?
I don't think anything is different right now, but I'm always hopeful. I'm an eternal optimist. I mean, you have to be. Otherwise you shouldn't be in leadership, for one. All right. So here's an important question for all of your audience to think about. How is it that over several months now of a pandemic, we don't have a FEMA-like response here in Central City, Milwaukee? We know that African Americans in the Latinx community has been hit extremely hard with the COVID-19 virus. If it was a hurricane or a flood, the next day there would be trucks with FEMA water, okay? Why are there not trucks in Central City right now issued from the governor and declared by the mayor to ensure that you can't just have testing, you have to have resource distribution, which means that people have to have access to masks, hand sanitizer, and disinfectant agents, okay? So physical separation and physical distancing is important, but we know how difficult it is because of the impact housing that we have here. So you cannot expect people to abide by all of these suggestions without resource distribution. This right now in Milwaukee is a COVID-19 resource desert. And that can be addressed immediately with the governor asking Wisconsin companies to start producing disinfectant wipes or disinfectant agents and hand sanitizers and allow the community health centers and other community-based organizations to distribute it out immediately.
Dr. Izard, last and final question. What are you most optimistic about right now?
Well, I'm always optimistic because I believe in people, and I still believe in the American dream, meaning that the American dream has always been about hope. And the hope is about seeing the future of what we could be if we decided to work together. If we decide to dispel all the myths that we're different and to actually decide that we are much more alike than we are different. Okay, so I am hopeful that rude awakening will happen over time, but sometimes it happens with pain.
Dr. Izard, thank you so much. I wish we had a lot more time to continue this discussion. Thanks so much for your great message today. Thanks to everyone who tuned in, and thanks to our generous sponsors for making today's discussion possible.
Thank you, appreciate it.